So I hope you enjoyed seeing the Star Awards winners, all of whom wonderful. In this part of the annual members meeting, we are going to take some time to hear about the work we're doing at Southern Health and the difference it's making to our patients and our staff. First of all, we're going to look at our primary care work, and to tell us more about it and take us through it is Dr. Robin Harlow, who's our clinical director and primary care lead. So over to you, Robin.
Thanks, Jenny. Hopefully everyone can hear me as well. So thank you very much for asking me to speak this evening. I'm going to do just a couple of minutes, and then we've got a short video about some of our staff and services and patients at the Willow Group in Gosport. So I represent the direction and care of patients and primary care that we provide both down in Gosport, which we've been doing for 5 years now, but also in Basingstoke, so at Shakespeare Road Medical Practice, which we took on in December of last year. So that's been a unique and exciting opportunity for us to work both to deliver primary care, but actually in partnership with our other sort of healthcare providers. So we work closely there with Solent, with our acute colleagues in Hampshire Healthcare Trust, and ICB, and ensuring that we are delivering services to the best of our ability and in a resilient fashion. So that's work that's ongoing and has been a new opportunity for us. At the Willow Group, we've achieved in the last year a merger with the Gosport Medical Centre, so we now are providing care to patients of over half the population in Gosport, so around 50,000 patients, over 5 sites. And again, that's brought in new GPs into the partnership and into the practice, which is key to, I think, as well as other roles, our resilience moving forwards, and continues to remain a challenge as it does nationally, but something that we feel particularly acutely in Gosport. But we continue to work to really try and endeavour to recruit and retain GPs, and we're partly doing that through GP training and registrars. We've done international recruitment, and we've had international GPs come and work and complete their training with us, which has been, as I say, it's been a very successful project, and has now added great resilience. And we've continued to work to develop new roles as well in primary care. So you'll hear a little bit about that on the video, but we've built up a team of physiotherapists that deliver care across primary care. They work in secondary care as well through our MSK service, and they're known as first contact practitioners, and are delivering care across all our primary care sites in Gosport. We've built up a pharmacy team, and so patients are starting to have the experience of utilising other services and expertise and helping provide their care along with the traditional GPs and nurses and advanced nurse practitioners. More recently, we've moved in supporting, or just about to recruit, dietitians into primary care, and we've had occupational therapists, paramedics in addition. So it's been great, and that's continued to allow us to evolve and develop new services as well. So we have been working and supporting our care homes. We have an acute home visiting service. We have our same-day access service to provide on-the-day demand for patients, and also broadening out into more holistic approach to care. So we have social prescribers, health and wellbeing coaches, which many of you may now be familiar with. But we've worked hard over the last year. We've had a couple of leaders, clinical and non-clinical, in developing the Willow Garden, and it's really been a passion of mine to ensure that we've got that off the ground. We've had Queen's Nursing Institute support that, and it's there for staff and for patients to use. We work with some of our local voluntary groups, some of our local charities in supporting care through the garden, and we hope now to expand that service and deliver that across Gosport with some of the partners that we work with. So again, more opportunities, as despite the challenges that we continue to face and the increasing needs and demands that are being placed upon primary care and wider services. So I think, Sarah, that was a brief overview, but just to start with the video, I guess. So my name is Dr. Robin Harlow, and I am a GP and clinical director in Southern Health. The Willow Group came together in 2017, and it was a response to the challenge, in particular around recruitment, and ensuring that we had a resilient primary care that we could deliver and continue to deliver for our population in Gosport. At that time there was a National Vanguard programme, and that was about establishing relationships between primary care and in part and secondary care and community services. There were a number of different projects that were happening nationally, but that one was the one that was the catalyst, along with the conversation in Gosport around same-day access service between different practices. And that really was for me, and the excitement for me coming to join at that point in 2017 when this was coming together, was about understanding how we could deliver primary care in a different way to how we were traditionally doing it, ensuring that patients were able to see the right person at the right time. That's a big philosophy of ours. So the idea was to try and bring all that together and bring that expertise together. We recognise that in Gosport there are significant challenges, and we did a recent presentation because we've just gone through one final merger, so we had 4 practices that originally came together, and then we've had a 5th that just joined us in April. There is demand in itself because we are in an area where there are higher health needs, there's more social deprivation here, but also with the challenges of staff recruitment, and particularly around GP recruitment and nursing recruitment. But again, that's what's so exciting here, is about the ability to bring in all these other services to help support that and all these other different roles and their skills. We have the same day access service that was established initially to manage all our same day demand, and that is through a multidisciplinary team approach, so again building on other roles within there. So yes, GPs are within that, but they are supporting the lead nurses and nurse practitioners that are in there, as well as paramedics that create that team. And then building on that, we then had the home visiting service, and again a nurse-led service. We've got very experienced nurses that have worked, and advanced nurses and practitioners that have worked across both primary care and community services, and bring that knowledge and expertise to that team.
Hi, my name's Kerry Hargrave, and I'm a nurse practitioner in the Willow Group. I'm also clinical manager for the nursing team. I currently I'm working in clinic, which is connected with the same day access team, and what I'm doing is fielding and triaging any responses that come in from patients, and allocating them where they need to go, so whether it's for the same day or whether it's a routine appointment that they need. The patients like the same day access service so much is because they know they get a response quite quickly. It has reduced our the number of patients that go to A&E and use the 111 service, because they know they're going to get a response on the day if they warrant that.
I'm Claire Wood, and I'm a community matron. I've worked for the Willow Group about 6 years, and I currently do 3 jobs really. My main role is I'm the lead nurse for the acute home visiting service. If anybody needs a home visit because they're unwell on the day, we go out and do that initial assessment on behalf of the GP. I'm also developing the frailty team, so we've now got OTs, physios and paramedics working with us for frailty. And my other job, which is this afternoon, I run an outreach centre for homeless people down at Two Saints. So people that find it really difficult to access primary care because of their lifestyles and choices and things. We deal with anything from mental health, substance abuse, wounds, anything like that really.
So my name's Dan, I'm one of the physiotherapists working for the Willow Group. So I'm here in clinic and ESTAS a lot of the time, or the same day access service. Our job really is to look after the bulk of musculoskeletal patients that come through our service. The idea is to put the specialist at the front of the pathway so we can get it right first time and make sure patients go where they need to go. So quite commonly patients hear the word physio and they think they're coming in for physiotherapy, but actually they're coming in for a musculoskeletal assessment essentially. And quite commonly we'll just give the correct advice and kind of get people to self-manage if we can, but we can also refer them onwards if we need to.
So my name's Jacqueline, I'm one of the advanced care practitioners at the Willow Group. So my main role as an advanced care practitioner is I do triage. So they come in from clinic in the morning and we triage and see what we need to bring for the day or treat over the phone. And that can be for adults and children, can be acute, so happening within the last few weeks, or chronic, that they need review or they need advice or they need referring on to somewhere else or another speciality, including hospital or someone within, you know, the actual GP surgery itself.
I think the patients have been on a journey with us, I would say, over the last 5 years, and again it's a journey that it brings its benefits and all the wealth of experience and knowledge and expertise that we're able to provide. And I think for patient care, that is brilliant.
I'm Marilyn Mullen, currently the Vice Chair of the Willow Patient Participation Group. It's amazing, in 55 years it has changed beyond recognition, from going to Broome where you had your family doctor who knew you and you always saw him, to the situation we have now. We all know it isn't perfect, we all know there's a lot of work to be done, but we are kept well informed. Emma, the operations manager, will give us lots of data, a number of referrals they've handled through a clinic, and then that gives us the ability to question. And I think that's the most important thing really, is that they listen to us. I think one of the things we have learned is that you don't always need to see a GP, and that's quite hard to get across to people, that there are so many people who've got expertise actually sometimes beyond the GP. They'd be the first to admit that if you see this person, they know more about what you want to know than we do. And I think that is gradually filtering through to people, that you know that we can be advised of the best person to talk to, not necessarily the GP.
And some exciting developments in multidisciplinary primary care down in Gosport, and really great to hear you're working so closely in partnership with your patients. Right, next we have a video that's going to tell us all about the enhanced mental health primary care team in Southampton.
My name's Emma Jones. I'm the primary care matron for the Enhanced Mental Health Primary Care team in Southampton. Our team are mental health professionals that are based within the GP surgeries across Southampton. We are able to provide signposting, assessment, triage, brief interventions, and we're working towards group interventions also. So when we look at patient referrals, when a patient presents into the GP surgery, they may see a GP or different professional, and then the referral will go towards our team, and the mental health professional will book an appointment with that patient. And that initial appointment is about assessing the patient's needs and looking at what their goals are and what support we can give them. If we're not the right service for them, we are able to signpost and liaise with other services. What this service has done is enable the patients to have a more timely service, a more patient-centred journey, working in a real recovery-focused way, so giving the ownership back to them. And Southern Health have a contract with Solent Mind, and they are peer recovery workers. So they're support workers with lived experience, they promote hope and recovery, and they do goal setting, and it is about community integration and social inclusion with the patients, and we have them in the surgeries alongside our practitioners.
My name is Suzanne Wright. I'm a peer recovery worker. A peer recovery worker is someone who's employed with lived mental health experience but far enough ahead in their journey, who's also mental health trained, and working in my case with patients, GP patients, sharing my lived experience in an appropriate way to help them feel more comfortable, to help connect, build a rapport, and looking at their barriers to help them overcome those, to help remove them. And it could be pieces of work like doing graded exposure to help people get back out the door, out the front door, or into being amongst people again. I work with people who are dealing with unhealthy relationships that's impacting negatively in their mental health. So talking through situations, helping them identify their values and goals, and part of that is helping them become more assertive.
When I found myself in quite a dark place that I couldn't think for my happiness, all I was doing is looking after my kids, making sure they're getting everything they need every day. And all I was doing is like staring in one place, not knowing what to think about, not knowing what what I'm going to be doing, what my future is. And then being referred from the doctors to say that we have got a mental health coach within our surgery, just having that trust that surgery is quite a private thing, wouldn't get help without anyone knowing. And to be able to talk and just say what you're actually feeling was me feeling better already. In my culture, you can't really talk about your feelings at all. So to be able to talk to a random person about your situation is a big help in its own. I felt there was a lot of comfort in the room. So there's no one like going to be judging you, or it's just like you don't have to build up. Everybody's on the same level at that point in that room. And then when I think when Suzanne listened to me, and then when I heard her speak, I just thought, like, I wish I had someone like that. I know if going in that group has made a massive difference to me, because when I needed someone to push me, I couldn't be like, right, you need to get up today, you need to do that. I couldn't do that myself. So just saying yes to these groups, and it doesn't even have to be talking about myself, hearing the other ladies in the group, just knowing that someone else is doing better helped me a lot. Like, I remember some ladies used to come very emotional at the beginning, but by the end of it, we were laughing and we were making each other feel better. So I just think, like, there's not just me that feels like this every day. There's a lot of people feel really down a lot of the time. From there, I don't think I've gone backwards, because Suzanne's had a lot of sessions with me after then. You help me a lot every time I've seen you. It just, every couple of weeks, that reminder, like, you're doing well, like you're not going back into that place you were before. You're still thinking, doing things for yourself is good, still putting yourself first. Each surgery's got their own mental health coach. So it's not like you have to go to surgery because you've broken something or you've got a rash or something. It's just like, my mental health's not good, I need to go to the surgery to see the mental health coach, because my mind needs help. I need help. Yeah, that helped me a lot.
So my name is Bronwyn Evans. I am a registered mental health nurse. I am also the team leader for the Bitten PCN. I do a lot of liaison work with other services that we link in really well with. So our community mental health team, we have very close links with. We also work very closely with the local IAP service, for example, Steps to Wellbeing. We also work quite closely with No Limits. And we continue to grow and develop our network within Southampton, which has been incredibly helpful for our patients, because if we have a little bit of a complication, or if a patient is finding that actually they're being passed from pillar to post, we can stop that from happening, and we can go directly to these services and say, right, this is our challenge, this is the issues for this particular patient, this is what they need the support with, and from there we can move forward with something that's meaningful and purposeful, rather than that patient falling through those cracks and inevitably either becoming worse, becoming frustrated and losing faith in mental health services. But that's where our role is quite unique, and it's interesting because we can have that discussion and we can help them to explore things a little bit more, and just to tap into that reflective part of themselves, so that they can do the discovering themselves and then share their eureka moments with us, which is wonderful. I love hearing those stories.
When looking at accessing mental health services in Southampton, I imagine for the patient that could be quite confusing and unsure of where to go. What our team is trying to do is bridge that gap between primary care, which is a GP service, and also the secondary care, which is the community mental health team. I think patients may have found before the criteria and the threshold is quite high, and that they might fall short of that and then be left in the middle. So our service is about providing that mental health support in the surgeries. So in one given day, they might see anywhere from 9 to 16 patients a day, and then you have multiple practitioners. Part of the next year is really about developing, embedding what we do, and further looking at groups, interventions, and that psychological approach with our patients. I think a really big aspect of that is patient feedback, care and family feedback. So please do bring that feedback to us, because it is how we reflect, how we change, and how we develop the service.
Huge thanks to Sally for sharing her story with us. And I'm delighted to hear that you were able to receive mental health support via primary care. And it was wonderful to hear what a difference our mental health nurses and peer recovery workers such as Suzanne can make to patients like Sally. Okay, and speaking of staff, I'm now going to introduce Satnam Sagoo, who's our Chief People Officer, and she's going to talk to us about how we recruit fantastic staff into Southern Health and how we keep with us. So, Satnam, over to you.
Great, thank you, Jenny. And just to echo what everyone's already said, there's a huge amount of work that's been done, and just to really thank you to all our staff for doing that piece of work, or looking after patients, supporting each other. So much of the work we do around supporting is based around our people plan. So you'll see a brief infogram there. And it's been designed to really ensure that we have a great people experience. And we've talked about that throughout today, this afternoon, really about that piece of work around what are we doing to support our staff and celebrate that. So this people plan has been designed to ensure that we have people so that we can support our people thrive and provide the opportunities for people to find the best patient care. Our people plan this year has been designed to be aligned with the NHS People Promise, and which focuses on 4 key areas: looking after our people, belonging in the NHS, growing the future, and new ways of working and delivering care, which, as you can see, has come through much of what we talked about this evening. So we're shortly going to go into a video about talking about the program work that we're doing, which is around attraction, recruitment and retention. And that really tells you about the piece of work that we're doing in those areas. And this is part of our plan, and it's something that we monitor regularly, and we want to ensure that we attract and retain the best people as well. So we're now going to go shortly to video, I believe.
Hello, I'm Paula Hull. I'm Director of Nursing and Allied Health Professions here at Southern Health. We all know that over the last few years, the NHS has struggled to retain staff and to recruit new staff. We have been doing a lot here at Southern Health to listen to colleagues about what's important to them about working here. What makes an organisation is the people within it, their beliefs, their aspirations, personally and professionally. So we've been listening to people to hear what their personal aspirations are, what inspires them, the sorts of environments that they want to work in, and talking to them about the challenges of working in really difficult situations. We've been really pleased that we've been able to develop the ACE Academy, the Academy of Clinical Excellence. It's for each and every nurse and allied health profession and healthcare support worker in the Trust. It's where they can get career coaching, where they can get education, qualifications and support with development in their careers. We're really starting to hear back from people that this is making a real difference to their working lives.
So I actually started working in admin. I kind of was completely new to mental health, and then I quickly learned that I wanted to be a support worker and then in the future a nurse. So I spoke to the management team and they were really great, kind of opened up a job for me. So I started from admin, then I went to a mental health support worker, and then recently I've just started my nurse apprentice mental health training.
We're also doing things like preceptorship, where newly qualified nurses come to us and get support, development and role modelling from other senior nurses to support them in their new roles. We've been going to colleges to talk to young people about their aspirations and careers in the NHS, and we've also been talking to lots of people that work here already who might be in a healthcare support worker role and might have aspirations to become a registered nurse or a registered allied health profession. And we've been absolutely supporting many of those individuals to go into those roles.
Hello, my name is Anne. newly qualified mental health nurse. I've been working here for 9 months now. I started October 2022. I used to work as a support worker, then before I went to uni to study mental health nursing. All my placement was local here in Southampton. So there was preferences, like if you have kids, they will give you preferences. So my first placement was actually on Antelope House, Trinity Ward. Then I did a second one in the community. Then I did another one in older patient ward in Melbury Lodge. Then back to community. Then I did my final placement here. That's why then when I finished my final placement here, the environment was very conducive, very good place to learn. Then I decided to come back and work for them.
We are very lucky, and I feel very privileged to have a large number of internationally educated nurses working here at Southern Health. We've worked really hard to provide them personal and professional support in coming to a new country, sometimes away from their families, and providing that support to them in an environment where they can learn about new population health and different experiences of delivering care in a different country. I have been amazed at some of those individuals, and some of them have already developed into more senior positions, and some of them have moved into roles such as practice educators. And one of those is Greg Hines, and he can tell you all about the amazing work that we are doing to support internationally educated nurses working with us and developing their own careers here at Southern Health.
Hi, my name is Gregory Hines. I am the practice education lead for international nurses. So we support the international nurses when they first come to Southern Health. We are involved in the OSCE preparation. The OSCE is the Objective Structured Clinical Exam. We have them prepared to pass that so they get the NMC registration. And then after that, we take them through the Trusts induction process. We involve them in the integration program, which helps them to learn the skills to develop into UK nursing, and then we also support them with one-to-ones and supervision and everything else on the wards.
I'm George Gomez-Zacharias. I am the present ward manager at Dear Leap at Leamington New Forest Hospital. I was at a point in my life where I did my undergraduation, then I did my master's in nursing, and I was looking at an opportunity to leave. And somebody on LinkedIn was very interested in my profile and said, would I be keen about moving to the UK? And I said, yeah, why not? Nothing wrong in trying. You have more than enough support. I'm the living example for it. I'm a brown dude from the south of India, from 35, 40 degrees. I've come here. I started off as a band 5. I'm a ward manager now. I also take my ward manager's responsibility more seriously for international nurses because I've been one myself. So I know what the gaps were, and I ensure that those gaps don't exist when my new recruits come. Asians or Southeast Asians are very hospitable people. We are very much, we see God in the guest that comes home. There's a Sanskrit word that we use where we say that the guest that come home is as important as God. So that filters through the care that we deliver. The patient is at the heart of everything that gets done. Whatever needs to be done to keep them happy, to keep them content, and to ensure that they are safe will be done. Moving from the Indian healthcare system to the private and then coming to the NHS, I can say this much, that the NHS is truly a national treasure. It's been 70 plus years now, and unfortunately it's going through a turbulent time. But however, all of us are here to make it work, and we will do our best to keep it serving the public. The UK in itself is a very diverse country, By having more international nurses, the more diverse it becomes, the more inclusive it becomes as a system, treating everybody from every culture and every race and every creed. That will only make the NHS even more beautiful.
One of the things that we absolutely take time to talk to people about is their health and well-being. We've got a number of things like fast track opportunities where you can get MSK or physio support more quickly as a staff member. And we also do the same for some of our IAPT services if people require counselling or support or any psychological support while they're with us. It's really important people get their clinical supervision and their reflective time and their away time away from their team so that they can think about their role and how they fit in the team and talk about some of the concerns that they have. We also have things like whistleblowing and speak up to make sure that people feel that no matter what, they can talk to someone, and if they've got fears or concerns, they can talk about them. One of the things we have been doing are recruitment fairs. We've had over 10 so far in all sorts of different parts of our organisation, often in one of our units or hospitals. What we do at those fairs is we have people that are doing the job there to talk to you about what it's like to work in the NHS. And whilst I've been a nurse for 34 years, what I do know is the NHS only works because of all of the different people that work in it. Whether you're a cook, a cleaner, a porter, a senior manager, a physio, an OT, or all sorts of other administrative roles that we wouldn't actually be able to see patients in the way we do without them. All of those roles are available to you. We have many services with complex mental health needs through to community physical health services, children and young people's services. We have services for autism and learning disability. There are so many different opportunities with music therapy, art therapy, drama therapy. It's such an exciting place to work. So if you'd like to know a little bit more about any of those roles, please visit us at one of our recruitment fairs or have a look at our website and see what roles are available.
Thank you, Satnam and Paula, and great to hear the staff talking about their careers and particularly to hear from our fantastic international nurses. Now, we were originally going to go to a video produced by Solent University students on our gambling service, but we're running a bit late, so we're going to pop that onto our website so you'll be able to see it there, and it's well worth looking at. It's a video. Now, you'll have seen during the presentation by the Willow Group, there are quite a few questions and comments. So what we want to do now is go back to Dr. Robin Harlow, who's just going to answer some of those for us. So Robin, back to you.
Thanks, Jenny. So thank you for the comments on the side. And I'm sorry to hear of some people's experiences or perceptions of the Willow Group, really. And I hope that the video has highlighted the team behind the Willow Group, and that everyone here is working hard to provide the best patient care that they can. In terms of the autism work and the comments on the side there, again, I'm very happy to pick up that separately and on a one-to-one basis. But I wanted to highlight really that we are working hard to support individuals and residents in Gosport who have autism. In the fact that we are working with Hampshire Autism, we meet with them regularly. We are doing some videos. They are just being finalised to help patients access our services. We've got a lead nurse that's been started to attend the monthly meetings, as well as one of our managers. And we are working with, we've been invited by Leslie, one of our local councillors, Leslie Ann, to be part of a work on and ensuring that Gosport becomes autism friendly. So there are lots of projects that are ongoing, and so I'm sorry to hear that that's not the experience that's been felt, really. And of course, we welcome any feedback to ensure we do the best we can with that. But as I say, we are passionate to support that. And in terms of the urgent treatment centre in the Mid and North, I don't believe that there is plans for that at current. But of course, there is a development of a new hospital, and whether I'm not involved in the conversations to know as to where that is and the progress that's being made. So I'm sorry I can't answer any further with regards to that.
Thank you. Thanks, Robin. And good to hear about all the things that are happening. And I recognise that things can be quite difficult and can be tricky for your patient. And it's brilliant to hear that you're working together with patients and their families to really try and improve things. And that actually is all we can do, is listen, learn, and continually improve. And the more feedback we get, the better we're going to be. So thank you to everyone who takes the effort, because I know sometimes it can be hard. Okay, so what we're going to do now is just go to our next session of questions and answers. And Addie Williams, who's one of our non-executive directors, has kindly agreed to chair this session. So now I'm going to hand it over to Addie. Over to you.
Thank you very much, Jenny, and thanks everybody for your contributions this evening. Apologies that it's such a packed evening that we've had so much to talk about and so many questions and input that we're running slightly behind. But we've got two important questions that have come through, and I know that there's been a lively chat conversation going there. So, really good to bring these two out and for us to be able to just discuss them and really call upon our colleagues and the team here to help to answer some of this. So the first one is really talking about something that I think we would all certainly want to see a more joint up approach in. And the question says, with the high numbers of railway suicides happening in Hampshire, is the trust helping other agencies or working with other agencies, I guess, to close or to safeguard the hotspots for this? And I was going to pose that question to Vicky, if that was okay, just to is that okay, Vicky?
Yes.
Lovely to meet you. You don't mind introducing yourself to us as well.
Yes, so if I just start by introducing myself, I'm Vicky Larkin and I am the Interim Chief Medical Officer. I started in post a week ago, so I'm afraid I may not be able to answer all your questions, and I will look to my colleagues to help out with that. Regarding the specifics about railway suicides, I mean, it is a real concern, and obviously, the Trust does everything they can to work with other partners to support some of these issues. I'm very aware that we work very closely with the police and have police liaison staff that can help to move some of these issues on. I'm not personally aware of other things that we're doing with other agencies. I don't know if anybody else can help me out on that from the panel, if there are other agencies such as the railway specifically that we're working with at the moment. Eugene.
Thanks, Vicky. Happy to add. So there is a suicide prevention strategy for Hampshire that we are engaged in and work with as a key partner. It's a public health initiative, but it draws in all of the statutory agencies as well as ourselves. And within that, particular hotspots, unfortunately, railway crossings and sort of bridges over motorways and things like that are sort of areas that do become hotspots. There are safeguards that are put in terms of railings or other warning signs or warning, or also awareness raising for those staff that are around in those areas to potentially respond and alert the authorities if someone was behaving in a way which caused them some concern. So in this particular one, I'm sure that is already highlighted in our policy, but I will check directly to ensure that that particular area is that we've responded to that accordingly.
Thank you very much. Thanks for that. And thank you, Vicky, for allowing us to put you on the spot there. And thanks for your input into that question. The next question I've got is actually one that I'm sure that many of us here will remember. There is a very topical conversation happening at the moment following a very tragic event, really. And I think if you've had the opportunity to listen to the campaigning voice of the mom behind this, you would understand that actually bringing the patient voice to strengthening the patient voice, is now something that the government feels is the right decision to make. And I think we would all know that for us, especially in the care that we provide, we have always had in our value to make sure that we do not see us as doing things to people, but working with and for. And the question is saying, is Southern Health making any changes to its operating procedures to provide a clearer system for patients who want to use a clear process for patients to use to seek for a second opinion? And I've got this. I was thinking maybe Eugene, if you wouldn't mind helping us to navigate this one, and maybe Paula could also add in.
Yeah, I think Vicky might be able to help me with a double act actually on this one too. But I guess I think the principles of getting things right the first time are probably where to start. So diagnoses and ensuring that people get the right treatment is something that we need to ensure that our clinical staff are engaging the right people in those discussions to develop that assessment. So not just the service user, but also their family and the wider kind of caring network to draw in that history and information. We do know that on occasions there is a difference of view in terms of what the diagnosis is. And I know that Vicky has been directly involved in some of those more complex discussions, and I'm sure we'll be able to offer some insights. But certainly our approach is that where there is a difference of opinion, we want to establish what the right treatment regime is, what is the right treatment and course of action. And we certainly will, and we do, go out and ask more objective opinions from people not involved with the patient to make that assessment and judgment. But Vicky, can I invite you in to add a little bit more on that one? Thank you.
Thanks, Eugene. Yes, so it's already possible for patients and carers to request a second opinion, and also that sometimes a team working with the patient and their family will consider that a second opinion might be a good way forward. So we would either look for somebody else with that expertise in the trust that we could ask to support that, or quite often we will go outside the trust and find people with that expertise in a different trust, so that they can come in and provide, as Eugene said, a more independent assessment. We really want to learn from our patients and our carers and families, and so we haven't any specific plans at the moment to change our policies, but that's something that we would very much value your views on, so that we could know what we need to do differently, and how to do that in a way that makes it easy for people to understand and seek that second opinion when they want it. So that is something that we will be looking to think about going forward. Obviously, there will be some advice coming nationally, I think, with the Martha's Law sort of discussions that have been happening recently. So obviously we'll follow any of those, but we would very much value our opinions from our partners around, and families and carers around, how we would move that on, really. Thank you.
Thank you. Thank you very much.
Thank you. Thank you very much. And I guess it's also just to pass over to Jenny now.
Thanks, Adi, for taking those questions. And just in response to the question that came up around charters, we do already do second opinions, but we'll be looking very closely at charter standards and making sure we embrace them enthusiastically to give people as many options as they need. So it's been a great evening, and thank you for joining us and for your participation and honesty through this. We've seen a snapshot of some of the things that we've done this year, the development of some of our primary care services, some of the improvements that have been made to the physical environment for our patients, and also the focus we've got on the triangle of care to work really closely with patients, their families, and their carers alongside staff. We've heard a little bit about Project Fusion, which is a really exciting project, and next year you'll be hearing from us in the new trust. And most importantly, we've seen some really powerful examples of where our services have made a real difference to people's lives and helped people to turn their lives around. So I want to thank everyone, and to all of our staff who come in every day and bring their commitment and passion to work to do the best they can that day. And also to all the people who've joined us and taken the time to share their experiences, particularly when they haven't been great, because that can be really difficult. And I hope that we've shown this evening that we want to hear, that we are listening, and we will do everything we can to continue to improve our services. So thank you all for joining us. Hope you'll join us again next year, and please enjoy the rest of your evening. Good night.